Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's video is a very common complaint by many patients in our consultation that I have the pain in the ear. So we will discuss today about the ear pain or earache in the medical language. Like for example, body ache. You might have heard about body ache. So ache means pain. So it is related with the pain in the ear. Myself is Professor Dr. Rajendra Raghuvir Deshpande. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. This is my WhatsApp number 9226810630. You can definitely contact to the Ayurveda Academy through this WhatsApp number for paid online consultation and paid online BMS classes. My dear friends, this is a part of playlist. You can say that it may be the part of Kaya Chikitsa, but it is basically related with Shalakya Tantra. So let us start to discuss about the ENT-Shalakya Lecture. This is actually the Shalakya Lecture, this is Ayurvedic word, and this is the last year subject for the BMS students. This particular topic is also included in your syllabus. So we will discuss about ear pain, earache or otalgia. Earache, to diagnose the root cause of the ear pain. Why there is a pain? Each doctor should have this particular instrument, which is called as otoscope. My dear doctors, please immediately purchase this instrument. This is otoscope. This is very, very useful in your medical general practice. This instrument is cheap, not costly, so economical. And this is very basic instrument if you want to treat the patients of ear, nose, throat, etc. With this otoscope, the doctor can see the external auditory canal and tympanic membrane. This instrument is useful to find the main cause of pain in the ear. Why there is a pain? In addition to the otoscope, definitely doctor will require mini torch that can be used to diagnose the earache. So these are the 6 important causes for the pain in the ear or earache. Don't forget these causes because treatment will change according to the cause. And Ayurveda always recommend that Sankhepataha Kriyayogo Nidana Parivarjanam. Nidana means cause. Ayurveda always recommends try to find out the root cause and try to treat the root cause. First cause is impacted wax. Second, furuncle. We are going to discuss this particular causes a little bit more in detail. Otomycosis, this is fungal infection. Acute otitis media, that is bacterial infection of the middle ear or blockage of eustachian tube. Earache may be because of the cause outside the ear. Actually, the problem is not in the ear. There will not find any problem like wax, furuncle, otomycosis, otitis media, nothing. So cause may be in another organ than the ear, and the pain is coming from that organ. Like for example, caries tooth. Okay, so that is called as a referred pain. That means the main pain, although it is paining, your ear is paining, but the cause is not in the ear. And the last but not least important cause is infection of the mastoid bone. ITS, remember this word, ITS is always inflammation. Mastoiditis, inflammation of the mastoid bone. Again, I will repeat 6 important causes of earache: impacted wax, furuncle, otomycosis, acute otitis media, referred pain, and mastoiditis. Let us discuss each cause a little bit in detail. Impacted wax. Wax is a secretion. Wax is a secretion from 2 important glands, sebaceous glands and ceruminous glands. The normal secretion of the sebaceous gland is material like the cheese. This is kept in solution by the secretion of ceruminous glands. If the fluid portion evaporates or becomes less in amount or gets destroyed, then thick wax is formed. So impacted wax, the most common cause for the ear pain. The doctor can remove this particular wax by a special instrument which is called as a wax hook or vettis. Remember, whenever you want to remove the wax, don't visit to any quack person which you will find on the roads and they will tell that we will remove your wax from the ear. Don't do that. That because perforation of the tympanic membrane is a very serious complication and that infection can reach even into the brain. Remember my words. So don't neglect, don't do anything unscientific or unhygienic. So there is an instrument, wax hook or vettis. Doctor is using that for removing the wax. How it is removed? Press the hook beyond wax. This is most important. Don't use Johnson & Johnson buds or stick from the matchsticks. Don't do that because that hook is placed beyond the wax and that wax is pulled by gentle traction. If while removing the patient is crying, oh doctor, don't do it, because if this particular removal causing the pain or doctor is seeing that the wax is too hard, then you should not do, anybody should not do, doctor should not remove or try to remove the wax. Stop the attempt. Then what to do? That hard wax should be first diluted. So it is called as Waxol eardrops or Solivax eardrops that will liquidify that hard wax. Solivax or Waxol eardrops are available in the market 6 times in a day. 2 or 3 or 4 drops in each ear. Where there is hard wax, you should put down eardrops and then within a period of 6 or 7 days, that wax will be liquidified or a little bit softer. Remove a softened wax after 6 days using oral syringe. This is another instrument. The doctor should learn how to use this oral syringe. If syringe is not available, remove the wax again by vettis or wax hook. But here, my dear doctor friends, do not use hydrogen peroxide H2O2 or earbuds to remove the wax. Don't use the hydrogen peroxide. Don't use Johnson & Johnson buds. They are for another purpose. Don't use it for removing the wax. Impacted wax, Ayurvedic treatment. For local application, Ayurveda says hardening is because of the dryness of Vata dosha. Vata dosha is making this wax hard. So what is the best treatment for Vata dosha? Snehana. So oil, lubrication with oil. So there is a Karna Shula Hara Taila. Taila means oil. Lashuna Taila or plain sesame oil, that is Tila Taila. Remove the loose wax either by scooping or by syringing with warm water. Next cause for the pain in the ear is furuncle. What is furuncle? Furuncle is a staphylococcal infection, simple bacterial infection of the hair follicles in the cartilaginous portion of the external canal. So this is bacterial infection of the external canal. What are the predisposing factors? Why this infection occurs? Trauma by pricking, soddening of the skin due to the swimming. Infection comes if the water is not clear or there is contamination from the another, what you can say, the infected person. Then there may be cause like metabolic disorders like diabetes mellitus. So whenever the furuncle patient comes to you and if you see that the person is above 40 plus, then definitely you ask him to do fasting and post glucose blood sugar or glycosylated hemoglobin. Okay, if the level is beyond 6.5 glycosylated hemoglobin, you can say yes, patient is diabetic, and because of the diabetes, this is a predisposing factor, he is getting infected. So you have to do the antibiotic as well as you have to control the blood sugar. Unless and until blood sugar is controlled, there is no use of using only antibiotics. This is very clear. When there is a furuncle, bacterial infection, in the ear canal, this is very tender to touch. Sparsha sahatva, the patient will not allow to touch that particular boil. Then you have to use very strong antibiotics like capsule vaccine, 500 milligram QID, 4 times in a day for 5 days. Then analgesic and anti-inflammatory tablet Voveron SR, sustained release, 100 milligram morning and evening. And in addition to that, Otogesic ear drops 4 times in a day, 2 drops, morning, afternoon, evening, and at night. Furuncle, Ayurvedic treatment. Ayurvedic antibiotic-like medicine, Gandhaka Rasayana, it is available from Ayurveda Rasashala Pune. 1 tablet 3 times in a day. Sukshma Triphala, again of Ayurveda Rasashala Pune, 2 tablets 3 times in a day. This combination of Sukshma Triphala and Gandhaka Rasayan is the best antibiotic of Ayurveda, best antiseptic from Ayurveda. Don't forget, anywhere in the body, if you find there is infection, always try to use Sukshma Triphala and Gandhaka Rasayan together. Ayurvedic analgesic anti-inflammatory tablet Vatari, available in the market, 1 tablet 3 times in a day. Next cause for the pain in the ear, that is otomycosis. Otomycosis, mycosis means fungal and ear, auto means ear. So this is a fungal infection of external auditory canal. How you can see that particular infection? You will see, doctor will see white cotton-like mass with black spores in the mass, white cotton-like masses. Always whenever there is allergy or fungal infection, itching is predominant. Pruritus. Itching is very common in allergy. Itching is very common in any fungal infection. Also, there will be pain. What to do? Remove the debris with wax hook or a cotton bud. Here you can use Johnson & Johnson cotton bud to remove that debris. Then antifungal treatment. Candid ear drops, 4 drops 3 times in a day, that is tedious. Then anti-allergic to control this itching, antihistaminic tablet cetirizine, 10 milligram OD. I prefer this tablet should be given at night. Always remember, antihistaminics and anti-allergic should be used at night only, because of course this is causing very less drowsiness, but many antihistaminics and anti-allergic medicines of allopathy causes drowsiness. So after taking this medicine, ask the patient, do not drive, do not go near the furnace or fire, do not go near to the water reservoir, do not go for swimming. Drowsiness may make accident. So cetirizine is useful to control when there is itching 3+, very severe itching. Otomycosis, actually antifungal is only sufficient, but if there is a secondary infection, secondary bacterial infection, then there is a need to use antibiotic like capsule vaccine, 500 milligram, 4 times in a day, QID. Remove the debris again after 5 days, and then genticin HC, antibiotic with steroids, ear drops, 4 drops 3 times in a day. Otomycosis, Ayurvedic treatment. Wipe off external ear with spirit swab and dry with cotton. For local application, Sthanika Chikitsa, Vrana Shodhana Tail or Paribhadra Tail. Tail means medicated oil, or Isab Gajakarna Malam. HP means Hari Parshuram Aushadhalaya Pharmacy from Pune. Hari Parshuram Aushadhalaya Khadiwale Vaidya. They are preparing this Isap Gajakarnamala. You can apply 2 times in a day. Internally in the abdomen, thyrostatin. This is a blood purifier. Thiostatin, THYO, thiostatin, tablet thiostatin, Ayurveda Shala Pune, blood purifier. 2 tablets 3 times in a day with Mahamanjishtadi Kwath. Kwath means decoction. Manjishtha is also blood purifier. Mahamanjishtadi Kwath, 4 teaspoons with equal amount of water 2 times after meals. Next cause for the pain in the ear, acute otitis media. You can use the medicines because this is a bacterial infection of the middle ear. Capsule vaccine, 500 milligram 4 times in a day, QID, for 5 days. Don't do antibiotic course haphazardly. If you stop any antibiotic immediately after 1 or 2 days, then antibiotic resistance will develop, and next time when you use the same antibiotic, it will not work for your body. So to prevent the antibiotic resistance, you must complete this antibiotic course as prescribed by the doctor. Tablet Voveron SR, sustained release. This is analgesic, anti-inflammatory. This is a brand name. The content is diclofenac sodium. 100 milligram 2 times in a day. BD means 2 times in a day for 5 days. Otrivin nasal drop, 1 BD 2 times in a day to keep the tube patent. Tablet Zyrtec D. This is antihistaminic, anti-allergic to control the allergic factor. Zyrtec D 2 times in a day for 5 days. Again, I warn you, whenever you use antibiotic, whenever you use the anti-allergic, antihistaminic, like these drugs, take precaution that the patient should be informed that there may be little bit sleepiness, drowsiness, and with this medicine, the patient should not go out of the house for his office, for his school, for his business. He should not drive any vehicle. He should not go near the fire. He should not go for swimming or near what you can say the machinery. Okay, so these precautions should be taken when the doctor is using anti-allergic or antihistaminic medicines. Autogesic ear drops, 3 drops each time, 3 times in a day. Next cause for the pain in the ear is referred pain. As I mentioned, why it is called as the referred pain? Pain is in the ear, but it is coming from the other organ of the body, coming from the other side, other organ. So that is called as a referred. For example, the child is having tonsillitis, inflammation of the tonsils, or quinsy. Then because of the inflammation of the tonsil, the person is getting pain, the child is getting pain in the ear. There is not ear problem. Problem is outside the ear. And that is why this is called as a referred pain. There is no wax, there is no pus discharge, nothing is found in the ear. Then you must see the mouth. Ask the patient to say ah. Then tooth. Impacted wisdom tooth also can cause referred pain in the ear. Third cause, arthritis of temporomandibular joint also gives the pain in the ear. So whenever there is a referred pain, you have to treat the root cause. You have to treat tonsillitis, you have to go for dentist and take out this wisdom tooth, you have to control the arthritis, etc. Last but not least, the cause of pain in the ear is mastoiditis. This is itis means inflammation of mastoid bone behind the ear. Behind the ear pinna, there is a hard mass, and that is a bone, and that bone is called as a mastoid bone. Infection of the mastoid bone is very serious because this infection can go into the brain, and there will be inflammation of the brain coverings like meningitis. There may be encephalitis. So to avoid the brain damage, you have to treat mastoiditis very urgently and very, what you can say, the very powerfully. So mastoiditis is a complication of otitis media. The infection goes into the bone. Diagnosis. History of otitis media, that is the middle ear infection, and severe tenderness on the mastoid bone behind pinna of the ear. What to do? Highest antibiotic like tablet septum, 250 milligram BD for 7 days. This is antibiotic. Then analgesic anti-inflammatory, which is called as NSAID, non-steroidal anti-inflammatory drugs, that is Voveron SR, sustained release, 100 milligram BD for 7 days. Another anti-inflammatory drugs for bone problems, tablet Chiamoral Fort, 1 tablet 4 times in a day, QID. And still you have to refer these patients to the ENT surgeon to avoid further damage or complications to the brain. So my dear friends, this is all about today's lecture regarding the pain in the ear pain or earache or otalgia. This is best lecture for the BMS students as well as for the doctors. And this lecture is a part of the syllabus of Shalakya Tantra for the last year BMS students. As these are all educational videos, हमेशा की तरह डिस्क्लेमर मैं आपको सावधान करना चाहता हूँ. Dr. Deshpande never intends or never support for self-medication to the patient. वैधानिक इशारा, कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्यकीय सलाह लेना बहुत ही जरूरत है. If any viewer is suffering from cerebral palsy, arthritis, diabetes, cardiac problem, MND, motor neuron disease, cancer, attention deficit hyperactive disorders in the children, idiopathic thrombocytopenic purpura, or any such type of chronic diseases or autoimmune diseases, you can take the consultation, paid consultation by WhatsApp on 9226810630 for paid online consultation or paid online BMS classes of any subject. So I request all of you to like this video, share this video, and don't forget to press the bell icon and subscribe my YouTube channel. I am very much thankful for your kind support and best wishes. I wish you all the best. Wish you happy, healthy, and long life. Take care and bye-bye.